So this video is going to look at issues around the diagnosis of schizophrenia. So in particular, whether we are reliable in diagnosing schizophrenia and if we are valid in our diagnosis of schizophrenia. So reliability is the idea of consistency. So the idea that clinicians must be able to reach the same conclusions about the diagnosis. So everyone is consistent in their diagnosis of schizophrenia. And we can test this via test-retest. So the clinician makes the same diagnosis on separate occasions from the same information. So if they were to read the information about a patient, they would diagnose them as schizophrenic, and then say a couple of months later they would receive the same information and again they would diagnose them with schizophrenia. So if that is the case, then we appear to have consistency. We are reliable in that diagnosis. Now another way you can assess it is the inter-rater reliability. So that's when different clinicians make the same diagnosis based on the same information given to them. So if we had two psychiatrists or clinicians and they were to be given the same information, would they both diagnose that person with schizophrenia? And if they do, then we have high inter-rater reliability. Now, validity is to do with the accuracy of diagnosis. So are we accurately diagnosing a person with schizophrenia? So do they actually have schizophrenia? Now we can look at this in different ways. We can look at it via predictive validity. So if we diagnose a person with schizophrenia and they are treated successfully, then it would appear, because we've been able to treat them, that our diagnosis was accurate. We were valid in that diagnosis of schizophrenia. Equally, descriptive validity. For it to be valid, patients with schizophrenia should differ in symptoms with other patients with other disorders. Okay. So if we move on to all the factors that can affect reliability and validity of diagnosis. So we talked about the idea that they should be different from other conditions. Now, comorbidity is when there is a presence of one or more additional disorders or diseases that happen with schizophrenia. So for instance, substance abuse and anxiety are common among patients with schizophrenia. Now, a meta-analysis found that 12% of patients with schizophrenia also fulfilled the diagnostic criteria for OCD, and 25% displayed significant obsessive-compulsive symptoms. So this implies that we might not be as valid in our diagnosis of schizophrenia because they have other symptoms, they have other disorders and diseases that could mean that we won't be as valid in that diagnosis. So if we look at an example question that there has been, in the context of schizophrenia, outline what is meant by comorbidity. So you'd talk about the idea that that refers to the extent that two or more conditions co-occur. So having another disease or disorder alongside schizophrenia, for example, substance abuse and depression. Now, symptom overlap. This is when the symptoms of schizophrenia are also symptoms of other mental disorders or mental health conditions. So in particular, some of the symptoms of schizophrenia occur in depression and bipolar. So most people who are diagnosed with schizophrenia have sufficient symptoms of other disorders that they could also receive at least one other diagnosis. So again, this draws into question whether we are valid in our diagnosis of schizophrenia, or are we just misdiagnosing another disorder? So symptom overlap can have a massive impact on that validity of diagnosis. So past paper question, there's been explained how symptom overlap might lead to problems with the diagnosis and or classification of schizophrenia. So with this one, you talk about the idea that there are overlapping symptoms. So there are symptoms that are common with schizophrenia and another disorder, such as depression or bipolar, which means that a person might be misdiagnosed or misclassified as schizophrenic when they don't have the disorder. Now, another factor that can affect it is culture bias. So this is the tendency to overdiagnose members of other cultures as suffering from schizophrenia. So in particular, people of Afro-Caribbean descent are more likely to be diagnosed than white people. So this suggests that culture has an influence on the diagnostic process. Now, research by Copeland gave US and British psychiatrists a description of a patient, and 69% of the US psychiatrists diagnosed them with schizophrenia, but only 2% gave them the same diagnosis. Now, this has a massive impact, so that would suggest that inter-rater reliability between cultures is very low, in that there was a massive difference between an American clinician giving a diagnosis of schizophrenia and a UK clinician giving the same diagnosis. Equally, Lerman interviewed 60 adults diagnosed with schizophrenia in Ghana, India and US, and many of the African and Indian subjects reported positive experiences with voices that they'd heard, whereas US patients were more likely to report these voices as being violent and hurtful and hateful. So this therefore shows that there are cultural differences between perceptions of voices which could lead to misdiagnosis in schizophrenic individuals. So gender bias can equally have another impact on whether we are accurate in our diagnosis, so whether we are valid. Now, the diagnostic criteria can be applied differently and tends to be applied differently between males and females. So that leads to a difference in the classification of the disorder. Now, typically, clinicians equate mentally healthy adult behaviour with mentally healthy male behaviour, and women tend to be perceived as less mentally healthy. So if we were to look at some AO3 then, so a weakness is diagnostic does not appear to be reliable. So Reed et al. In 2004 reported test-retest reliability of schizophrenia to have only a 37% concordance rate, which is really low. So therefore it would imply that it isn't reliable. Now, typically within psychology, we like to have a concordance rate or a coefficient of plus 0.8, which would suggest that we are reliable in that criteria, whereas this is 37%, so that is a low inter-rater test-retest, so it suggests that we aren't consistent in our diagnosis. Equally, a weakness is predictive validity is low, so only 10% of patients show a lasting and significant improvement, and 30% show some improvement. So this would imply that we are not valid in our diagnosis. We're not accurately diagnosing a person with schizophrenia because we're not able to treat them successfully. Now, equally, co-morbidity can have negative consequences. So Sim et al. Found that 32% of schizophrenics had an additional mental disorder, which can have a massive consequence. Equally, this led to patients with schizophrenia receiving lower standards of medical care, which could affect their prognosis and their improvement and treatment of their diagnosis. So if we were to look at a 16 marker then, discuss reliability and or validity in relationship to diagnosis and classification of schizophrenia. So this is an and or question, so you could just go down the route of talking about reliability or down the route of just talking about validity. However, I feel like it would be easier to talk about both of those within your answer. So what is reliability? How can we test reliability, and what are the factors that can affect reliability? So that could be the cultural differences that affect diagnosis. So the fact that Americans are more likely to diagnose someone with schizophrenia than someone from the UK. And then validity, what it is, test of accuracy, and the factors that might affect it, such as symptom overlap, comorbidity, and gender bias. Then you'd move on to your evaluation points about whether we are reliable and valid in the diagnosis of schizophrenia.